Once a hair follicle is extracted, the clock starts ticking. But what actually happens to the cellular biology of a graft while it waits in a holding solution? During the intraoperative phase of a hair transplant, surgical teams carefully coordinate the transition of tissue from the donor area to the recipient site. This interval is known as the out-of-body time. Hair follicles are living tissue, remaining highly metabolically active even when disconnected from the body's blood supply. Prolonged separation exposes these cells to ischemia, or a lack of oxygen, as well as dehydration. This can irreversibly damage the delicate dermal papilla responsible for hair growth. In his clinical approach, Dr. Caymaz emphasizes that meticulous architectural planning extends into the operating room, where protecting graft viability is paramount to the procedure's overall success. To preserve tissue during this interval, clinics use temperature-controlled holding solutions buffered at specific pH levels. This strategically slows down the cellular metabolism of the graft, buying crucial time until reimplantation. Dr. Caymaz's perspective on this phase is that strict procedural discipline prevents compromised blood supply from risking the follicle. Managing this biological limit is why large megasessions are often divided into smaller, meticulously timed extraction and implantation blocks. This methodical workflow ensures no single graft exceeds the safe ischemic time window. From Dr. Caymaz's planning philosophy, rejecting factory line volume in favor of focused, private operations allows the surgical team to maintain this vital control. The ultimate takeaway is that a hair transplant relies entirely on keeping living tissue alive. Every minute a graft spins out of the body matters.